I'm Bettina Herbert, a doctor who practices integrative environmental and functional medicine, and now, thanks to ACAM, I'm going to be adding restorative medicine because some of us are getting older. Some of us don't look like it, but others, we're getting older. So I'm practicing in South Carolina, in Rock Hill for now, and then the Gesundheit, which will be a wellness clinic, will be in North Charleston. And I'm so excited. It's my first ACAM meeting, and it sort of completes the whole circle of offerings. So I can nutritional IV, I can refer to like-minded providers, and we can form a virtual team and communicate with each other and have the whole care of the patient at the heart, at the center. In addition, there's a wonderful biologic dentist in Charleston, in Mount Pleasant, and we collaborate on patients. So it was wonderful to see at this ACAM meeting the cross-pollination, if you will, of the dental and the general health. I've known about ACAM for a long time, but I'm a second career physician. I finished my residency at age 50, so I felt I had a lot of catching up to do. So I completed the functional medicine curriculum, got certified, got board certified in integrative medicine, kept up my AMA boards, and became an expert in exposure to water-damaged buildings. So ACAM has been in the soup. You can't do everything in a few years, and I'm here now, and it was a wonderful experience. Especially exciting was the Peptide workshop pre-conference here, and peptides are made as one of the products from the DNA being read and created. Insulin, for instance, is a peptide, and it has many functions. The thing is that insulin can be synthesized, and now we know that hundreds of these peptides can be synthesized, which means we can correct errors in coding, augment weakness in the DNA, and also for those of us over a certain age, as the French would say, we can take them by subcutaneous injection and also orally, and a few by IV only. So that's what is exciting. And ACAM has been on the horizon for a long time. Let's talk about what you can do at home if you don't have the funds to do a huge workup with a functional, integrative, environmental physician. You can watch what you eat. Our environment, the food that we eat, the body takes it as information. So if there's high fructose corn syrup on the label, throw it away. It tastes really good because it's designed to be addictive. Take some simple things like highly processed foods and get them out of your diet, and especially your kids and grandkids. That doesn't cost much except the complaining that you'll hear. But you can model this for your family and friends as well by doing the same. Just add an extra vegetable a day, get rid of the white foods, and you're off to a great start.